So you recently completed a functional stool microbiome test and noticed that your firmicute levels are low. You might be wondering, what are these firmicutes? Why does it even matter if they're low? And what does this really mean for my health? Well, that's what we're going to break down in today's video, because when it comes to the gut microbiome, balance is absolutely everything. Now, Firmicutes is really one of the two major bacterial phyla that dominate a healthy human gut. The other is called Bacteroides, and I'll do a whole nother video on that topic. But together, these two groups make up the majority of your gut bacteria. They help maintain digestive balance, they help support immune function, and they even affect your body's metabolism. So when these levels are too low, it's a sign that your gut ecosystem, this terrain that I talk about, is really out of balance. Now, first, what exactly are Firmicutes? Well, Firmicutes is really not one bacteria. It's really a family, a large family of bacterial species. This group is well-known names like Lactobacillus, Clostridium, Ruminococcus, Faecalibacterium, propionate, which again has a very important role in regulating inflammation in the gut. But many of these species play critical roles in digestive function and immune regulation, and believe it or not, even your mental health. So what are some of the symptoms or problems that are linked to low firmicutes? Well, let's start with the gut, because there are symptoms in the gut and there are symptoms outside the gut. First off, they're responsible for breaking down complex carbohydrates. They basically ferment dietary fibers into something called short-chain fatty acids, especially butyrate. Now, butyrate is important because it's what nourishes your colon cells and maintains a strong intestinal barrier. It helps reduce inflammation in your gut. So here again, if your firmicute levels are low, you might be experiencing things like bloating, loose stools or diarrhea, food intolerances, low-grade chronic inflammation in the GI tract. You may have a phenomenon called leaky gut syndrome, which then leads to systemic symptoms. See, low firmicutes can also affect how your body regulates your immune system. There are some species within this group that are involved in educating immune cells so that they can distinguish between what's a friend and what's a harmful microbe. So again, if they're too low, you may notice more issues like frequent colds or infections. You may have allergies. You may have more frequent autoimmune flare-ups. But here again, the effects don't stop in the gut. They also produce compounds that influence the body's nerve system. Certain species help maintain and produce neurotransmitters like GABA and serotonin, which, if you think about it, are important for mood and mental health and focus and concentration. So when firmicute levels are too low, you might feel symptoms like brain fog, maybe low mood or depression, maybe anxiety or restlessness or irritability, and in some cases even sleep disturbances. And finally, there's the issue of metabolism. Again, some firmicute species help with nutrient absorption and blood sugar balance and energy balance. So again, low levels might contribute to fatigue, nutrient deficiencies, or even difficult maintaining a healthy weight despite eating good and exercising. So as you can see, low firmicutes on a functional stool test really isn't something to just brush off. It reflects a much deeper imbalance in your gut microbiome, and it has a ripple effect on digestion, immune system, mood, and your overall vitality. What causes firmicute levels to drop? Because there's several potential contributors that you need to be aware of. Frequent or recent antibiotic use, a low fiber diet, especially one that's low in diverse plant foods, chronic stress, digestive insufficiency, such as low stomach acid or low pancreatic enzymes. This can cause an overgrowth of competing microbes like Bacteroid species or proteobacteria. It's also important to understand that there's no single reason that's responsible for every case in terms of why they're low. So if your stool microbiome test shows that you have low firmicutes, this isn't just about bacteria, it's about your overall health and your body's resilience. These microbes are a core part of your body's inner ecosystem, and when they become depleted, many important processes begin to struggle. But the good news is this, is that once you've identified that they're low or that there's an imbalance, you're one step closer to finding the root cause of your symptoms. But interpreting the next steps properly really requires some personalized insight. And that's why it's so important to work with a qualified and certified functional medicine provider. They can help interpret the test results in the context, looking at your health history, your lifestyle, your diet, your symptoms, and they can then determine whether low firmicutes are driving your symptoms or simply a reflection of deeper underlying issues. So if your stool test shows low firmicutes, Take it as a valuable clue, not something to ignore. Your gut bacteria are more than just passengers. They're active participants in your digestion, your mood, your immune system, and finally, your metabolism. Understanding and supporting your microbiome is one of the most powerful ways, really, to support long-term health, long-term vitality. Well, I want to thank you for watching, and remember, if you're dealing with persistent gut issues, fatigue, immune system imbalances, or mood changes, a deeper look into your microbiome may provide you the answers that you've been searching for. Be sure to follow with a certified functional medicine doctor for, again, more personalized interpretation of your test results and really a plan that could be implemented and tailored to your needs. Take care of your gut, and in turn, it's going to take care of you.